You've studied your cardio. Let's test it.
Something's wrong. There's pressure in my chest. I can't breathe.
56-year-old male. Chest pain started about 45 minutes ago while watching TV.
He has heavy central chest pain, radiating to the left arm. History of hypertension, diabetes, and high cholesterol.
He's diaphoretic and hypotensive. We should get an ECG.
A 56-year-old man presents to the emergency department with chest pain that started 45 minutes ago while he was watching TV. He describes the pain as a heavy pressure in the center of his chest, radiating to his left arm. He has a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus. On examination, he is diaphoretic and mildly hypotensive. ECG shows ST segment elevations in leads 2, 3, and AVF. Cardiac catheterization confirms complete occlusion of a coronary artery. So, which of the following arteries is most likely occluded? Go ahead and pause this video so you can pick your answer. So, let's look at the important clues. There's chest pain radiating to the left arm and diaphoresis, which suggests classic MI symptoms. ST elevation in leads 2, 3, and a VF indicates an inferior wall MI. The time course, less than 1 hour, indicates an acute phase. And catheterization confirms occlusion. The inferior wall of the heart is supplied by the right coronary artery in about 85% of people. Right dominant circulation. ST elevations in 2, 3, and a VF equals inferior MI. Therefore, the most likely artery involved is right coronary artery, so B is our answer. Now let's look at why the other options are incorrect. Option A supplies anterior wall. Infarcts present with ST elevation in V1 to V4, not 2, 3, and AVF. C supplies lateral wall. Infarcts show ST elevations in 1, AVL, V5, and V6, not inferior leads. D supplies posterior septum and inferior wall, but in most people, PDA is a branch of the RCA. So saying PDA without specifying the dominant circulation isn't best practice on exams. And E supplies both LAD and LCX. Infarct would be catastrophic, with widespread ST elevation, anterior plus lateral, not isolated to inferior leads. ST segment elevations in 2, 3, and AVF indicate an inferior MI, which is most often caused by occlusion of the right coronary artery in a right dominant heart. Like and be sure to subscribe if you'd like more content like this.